Dr. Amy Rangwa, I must thank you very much for giving us this time. My first question is that the President's emergency plan for AIDS rehabilitation was launched almost 20 years now. How do you describe the program's performance in Ethiopia during these years?
Yeah, thank you for the question. You're rightly so. PEPFAR started in Ethiopia since 2004, so almost 2 decades. And the performance has been, what I can say, just stellar. When PEPFAR started in 2004, the HIV prevalence was around 7%. 2 decades later, we are at less than 1%, which is a tremendous progress. And this is thanks to the leadership of the Ministry of Health. We work together closely with the Ministry of Health, with U.S. government agencies and other donors to devise a response that is appropriate to the context here in Ethiopia.
Do you see any unique achievements of PEPFAR in Ethiopia?
Absolutely. The contribution of PEPFAR here in Ethiopia has been mostly through health system strengthening, working closely with the ministry to set policies, systems, and just an enabling environment for the implementation of prevention services, care and treatment services, and other HIV pieces response.
Mm-hmm. What do you think will be or is the most enduring change that this pandemic brought about in health service system, particularly in this country?
Yes, as I said, the PEPFAR has been working with the government to set the systems, and that's really helped with the sustainability piece. With strong health system infrastructure, with laboratory system to do the diagnosis, and with a health workforce that has been trained and is savvy and ready to respond, we are really confident that the gains will last, even outlast PEPFAR with the leadership of the Ministry of Health.
Mm-hmm. The other thing is, how do we evaluate the impacts of COVID-19 vis-a-vis your work regarding this HIV/AIDS? How did it impact your work?
Unfortunately, COVID-19 has impacted the world, not just Ethiopia. So all our work has been also impacted. First and foremost, through the supply chain that has been impacted, the delivery of antiretroviral drugs and other testing kits have been impacted, a little bit delayed because of COVID-19. Most of our patients also couldn't access services at some point due to the lockdown. But with PEPFAR and the system that were already set, we were able to put in place mitigation measures and just continue with the services.
What is the current situation of HIV/AIDS like in this country? Because in some places we hear that still the prevalence rate is high in some towns, and especially in Gambela and the likes. What is your assessment here?
So in Ethiopia, it's true. The prevalence is low countrywide. However, some regions are more impacted than others. HIV is focused mostly in urban areas. And some places like Gambela that you mentioned, and Addis Ababa, and the Oromia, and Tigray, those are some of our high prevalence areas.
Mhm. So what are the reasons behind all these in these specific areas?
The concentration of HIV. Yeah, so I believe, and this is through our work, we've been noticing that some regions are more economically attractive, and that attracts most people. And there are also key population who live in those areas, just going for economic opportunities. And that, I think, drives the epidemic.
Are you convinced that Ethiopia has made the most out of PEPFAR's program here?
Investment, absolutely. We're really happy with the working relationship that we have with the government. The government takes leadership, they take ownership of the program, and through the generosity of the American people, we have invested close to $3 billion into the HIV response. And that has been used effectively and efficiently to provide services where they're most needed. That said, there are still inequalities. Some population are more affected than others, and in the future, that's what we need to focus on as PEPFAR.
Can you quote some figures, like what's almost the total investment of PEPFAR in Ethiopia during the last 2 decades?
Yeah, close to $3 billion has been invested since 2004.
And what specific activities did absorb this amount of money?
Yes, thanks for that question. Through with the $3 million, and thanks to the American people who have consistently provided that funding year after years, we have been able to afford antiretroviral treatment for over 450,000 men and women and children. They have benefited from HIV diagnosis, treatment, and they have been able to achieve viral suppression, which is the key performance indicator for our program. So people are living healthier and longer lives. Back in the days, we remember an HIV diagnosis was almost announcing to you that you were going to die in the next 5 or maybe 10 years, who knows. However, today, people take the diagnosis as another diagnosis because they know they will have the treatment that they need. And that has been able to keep men and women living healthy, active lives, contribute to the economy, to contribute to the society. Babies are being born HIV-free to mothers that have HIV, thanks to those investments that PEPFAR have put into Ethiopia.
What were the lost opportunities you think the country should learn from in combating this pandemic? Lost opportunities that you may remember during these, years, that the country should learn from that lost opportunity, not to repeat and go on.
Yes, I think as I said, the government of Ethiopia has been really on the forefront and contributing to this fight. However, there's still room for improvement. The inequalities in terms of accessing services are really impacting the response. So one such lost opportunity could be focusing on the children, because we are noticing now that the children are lagging behind. More adults are taking treatment, they are living healthy lives, but the mortality of the children who are HIV positive is still quite high. And those are some of the lessons that we are learning, and that's we think should be the focus moving forward.
Last question probably. What specific plans does PEPFAR has in the next few years in Ethiopia?
Thank you for that question. Timely question, because we have just released a 5-year strategic plan.
Okay.
And the plan has 5 pillars. It focuses on equality, providing equitable quality care. It also focuses on sustaining the response. In addition to that, it focuses on health system strengthening and health security, all that focusing on science, data, and community leadership. So looking into the future, we will work toward improving sustainability, equitable services, and put the community at the forefront in the driver's seat to help move that response forward.
I said the last question, but let me let me ask one question, if this be the last. Do you think this program, these PEPFAR programs, have empowered people?
I believe it has tremendously.
What examples can you give me then?
As I said, throughout the 20 years of PEPFAR here in Ethiopia, healthcare providers have received training. This is a knowledge that they will keep forever. They've been sensitized, or the awareness that HIV is still a threat. It is a pandemic, and it isn't going anywhere. Since we do not have a cure yet, more programs are still needed to change the behavior, or even to reach people who are hard to reach. There are regions that we can't really reach because stigma and discrimination. People are afraid to be labeled as HIV positive. So some of them are still afraid to go seek care. So a lot is still to be done in that sense. And I think that's we're still committed to helping the government to do that.
How about the stigmatization? Do you believe that it has really decreased in terms of popular perception of the disease?
Absolutely, especially among the healthcare providers. Because at the beginning of the pandemic or the epidemic, when people were considered that they're going to die if they have an HIV diagnosis, even healthcare providers were discriminating against the people living with HIV. But now more and more people are knowledgeable. They know the mode of transmission. They know that they cannot acquire HIV just by touching the patient who has HIV positive. So the stigma among healthcare providers has reduced tremendously.
Are people more at ease to go to check their status now?
They are, and that's because there are treatments that are available. Now that people are not afraid to know the diagnosis, because they know they can still live a healthy life despite the diagnosis, they're more and more going to seek the care and learn about their HIV status and be put on treatment.
Do you have any specific message to Ethiopia or to Ethiopian people as a coordinator of this program?
Yes, I do. I actually have a message for the Ethiopian people and all the people who are listening to us. My message and what I'm going to leave you with is that we must remember that although Ethiopia has made significant progress in combating HIV, the gains can be easily reversed without focused, sustained, and equitable access to HIV services. So through PEPFAR, the American people remain committed to leveraging our investment effectively to make measurable and sustainable gains in Ethiopia's public health system and to prevent and control HIV/AIDS.
Thank you, Dr. Remy, for your cooperation and giving me this precious time of yours.
Thank you. It was a pleasure speaking with you.
Thank you.